Now, I'm not asking you to feel sorry for doctors, but they just want to practice medicine. There's a doctor I want to tell you about in Texas. Her name is Dr. Jules Madrigal. She's got a little solo practice. She's double board certified, but she has chosen to do a family practice. She's by herself. Her husband is an Olympic gold medalist on the U.S. swim team. He is now a stay-at-home husband to take care of their 2 kids so that she can practice medicine. And she charges $35, $45 for her office visits because she takes no insurance contracts and no Medicare. Patients pay her directly. And by getting rid of all those government regulatory hoops that she has to jump through and all that paperwork, she can reduce her costs by about $200,000 a year, which means she can charge those prices. She can get her patients $15 lab tests, blood tests. She can get $250 MRIs, which is cheaper than the nonprofit hospital down the road. She can take care of her patients. She gives discounts for teachers and preachers. And if you wear spurs into her office, she'll even take $5 off for you. Remember, this is Texas. The point is, though, that she's in charge of her practice. And she can do what she needs to do for her patients. That's the doctor that we're trying. Isn't that the doctor that you want? The doctor who gives you her home number, her cell phone number. You can text or call her anytime, 24 hours in the day. She will make home visits to you, house calls. That's the doctor. She says flat out, she will quit if this passes. Those are the doctors we're going to run out of business. And she's not making big money. She's making a nice living doing what she loves to do. So what I say is that we need to start taking back medicine. You are paying higher insurance premiums too because you don't get the tax breaks. The individual can't get the tax breaks that employers get. We have an employer-based system. Remember the very first thing I said is that I'm pro-choice? I want you to own your insurance policies. I want you to own your medicine. I don't want you to be relying on your job for your policy. I don't want you to have to get it from the government. You should have it. It should go with you wherever you are, whether you lose your job or change your job. You shouldn't have to choose between 2 or 3 policies that your employer picks. You should be able to pick anything you want. I am a health care insurance hostage. I actually live in Washington State. And because we have so many mandates on what insurance policies can cover there's 76 mandates of what's included, including maternity benefits, which I promise you I will not be needing, and things like wigs for patients who are going through chemotherapy. Now that's fine. If you want to buy a policy that covers all those things, you should be able to buy it. But shouldn't I be able to buy a policy that doesn't cover those things? Shouldn't I have that freedom to buy what I want? Where else can, other part of the market, can you not get what you want? So let me tell you, I want a high deductible policy with an HSA, a health savings account. I can't get it. So I am paying $190 a month, which probably sounds pretty good to most of you, for a policy I don't want, that I don't use. All I want is the hospitalization, the major medical part of it. There's no doctors on the plan that I want to go to. And I had a friend of mine here in Washington, D.C., who's an actuary, and I told him what I wanted in my policy. I found a policy from another state that was what I wanted. And he crunched the numbers for me and said if that policy were available to me, now remember I said $190? If that policy were available to me right now, it would cost me between $47 and $52 a month. Big difference. I am spending $150. I'm spending 4 times what I want to pay. So I'm paying for more insurance than I want. Some people aren't getting enough as much as they want. But the point is we're all stuck because we're at the mercy of a government program, Medicare, VA, Medicaid, or the mercy of our employers. So what I say is one of the first ways that we're going to take back this country is by taking back medicine. If we take control of medicine for us, not the government, and not the insurance company, and not the state regulators, then we start to take back this country. And that's what we're here to do, is to take back this country. Now I'm going to close and tell you what's going on really briefly in D.C. You may have heard about it this week. You know what? I want to tell you one more thing, because I just talked about D.C. There's another thing in the government. This is how stupid it is. When a Medicare patient comes to a doctor, doctors are prohibited by law from treating that Medicare patient for free. Didn't know that, did you? It's actually illegal. They must file an insurance claim to Medicare for the taxpayer's expense. So what that means is that even if Nancy Pelosi were not getting her health care off of the federal employees plan, as she is now as a member of Congress, even if she were just a private citizen multimillionaire, you'd still be paying for her medical care under Medicaid. Because, again, it's illegal to treat patients for free. Now, what kind of incentive does that give doctors to go back to the system of taking care of the poor? We have people who need free treatment in this country. We have people who need help in this country with medical care. And they've tied the hands of doctors. As Dr. Madrigal, Dr. Jules from Texas says, it's like driving a car with one hand tied behind your back. You can do it. It can be done. But somebody's going to get hurt. And that's what's happening now. We look at Washington, D.C. We don't even have a bill this week out of Congress, the Senate Finance Committee. Have y'all heard this? We have a concept of a bill with 500, almost 600 amendments. They're actually working on a bill that doesn't exist. They're going to vote it out of committee, and it doesn't exist yet. You know, we've all told you to take the pledge, to ask members of Congress to take the pledge to read the bills before they vote on them. This week, I need y'all to do something. I need you to call the Senate Finance Committee and tell them, show us the bill. Not just read the bill, but show us the bill before you vote on it. You have to put the pressure on the Senate Finance Committee. That's our one big thing this week. So that we can take back medicine. If you need more information, we've got materials. Another thing I'd really appreciate if you do, we have a petition. Support doctors. We've got a petition on our website to support doctors. It's takebackmedicine.com. Takebackmedicine.com and sign our petition. Because again, our first step right now in front of us is if we can take back medicine, we can take back this country. Thank you very much.